Hello, my name is Alondra Hernandez, and I'm going to be talking about measles. So, what is measles? Measles is a viral infection of the respiratory system. It's really contagious and can be transmitted through the coughing and sneezing of an infected person, as well as coming in contact with an infected person's saliva or mucus. When one contracts measles, some symptoms that may occur are coughing, running a high fever, sore throat, and most importantly, their skin gets red and blotchy like a rash. This first occurred in the 9th century when a Persian doctor published one of the first written accounts of the disease, but it is unknown why measles occurred. And the reason it was reported was because the Persian doctor was trying to distinguish the disease from smallpox. Many people underestimate the infection and don't see it as harmless because it has a vaccine, therefore it is curable. This then leads us to the causes of why measles outbreaks still occur. First of all, people refuse to get vaccinated or they don't keep up with their immunization records. An example of this is the Disneyland outbreak. This occurred in December 2014 when an infected person visited the park and infected 5 other people in the park, including employees. This then spread to other counties, and most of the people who were infected were people who weren't vaccinated with the MMR vaccine, which prevents you from getting measles, mumps, and rubella. Now, most people don't get vaccinated because of the lack of proper information. For example, the autism myth. The autism myth was the myth that spread widely, claiming that children who got vaccinated with MMR became autistic after. Once the media emphasized this claim so much, people then feared the vaccine, and because of this fear, less people actually went to receive the vaccine, causing many outbreaks. Other outbreaks are also caused by travelers. So this occurs when someone who doesn't have the MMR vaccine travels to a foreign country. Once they're there, they then pick up the infection by someone who's infected, and then they return to their homeland, infecting other people who also haven't received their infection there. So to prevent these causes, we have some solutions. First and foremost, of course, vaccines like MMR. Now, to implement these vaccines, we must educate the public about the actual pros and cons of them. Therefore, they're not so fearful about actually getting the vaccine. What is currently being done by the CDC is they impose strict regulations on medical facilities in which they have to notify the CDC as soon as they treat or come in contact with someone else. There are also programs occurring right now that influence vaccines for children. An example of one of these programs is Chalk Children's, and Chalk Children's educates the community on how to prevent measles. They also influence younger generations to get the vaccine once they are a certain age and when they are about to begin school. And Chalk Children's is actually one of the programs affiliated with the UC Irvine School of Medicine. And together they provide the public with the truth about vaccines and the seriousness of preventing measles. So lastly, I just want to let you guys know that I believe that measles seems to be an easily preventable infection if the community as a whole takes the right precautions. And to do so, I believe that the United States should keep a close surveillance of the country. That way we can ensure that if there are any more outbreaks, they don't get out of hand. Most importantly, to prevent measles, we should educate the public on the vaccines that we have, because once the community realizes the reasons why these vaccines are being implemented and constantly recommended, it makes it easier for the country to eliminate the measles infection. And then I have some questions for you. So after listening to the presentation, do you believe that the CDC regulations mentioned are an effective way to prevent future measles outbreaks? And how does the lack of vaccine education hinder the decreasing number of measles outbreaks? Thank you, and I hope you have a nice day.